Assalamu alaikum. Now I would like to talk about shock liver. Do you know what happens in shock liver? Suppose to understanding shock liver, suppose a patient came with cardiac arrest. So immediately we have done ECG and found ST segment elevation in the inferior lead, and we found there is an episode of ventricular tachycardia which is treated with IV amiodarone. He immediately taken to cath lab and the PCI done. His normal, his neurological function and other things are normal. What happens after 1 week? 1 week he goes. He has been discharged with after PCI done. He has been clinically normal. So he came back to you with the complaint of what? With the complaint of he has jaundice, he is icteric, and all the markers of the LFT like AST, ALT, ALP all are raised, and bilirubin is mildly raised. So what should be thought? What should be the reason why he has this type of raised transaminases? First of all, from the history, we found out he has an attack of myocardial infarction, VT, and cardiogenic shock, and these results in ischemic hepatitis or shock liver. In shock liver patients, transaminase level actually raises more than 1000. It usually rises after several days later. This is this is a sign of poor prognosis, and there may be multi-organ failure. If these patient survives, the hepatocyte injury tends to be self-limited, and aminotransferase level usually resolves within 7 days, and bilirubin level normalize over the course of several weeks. In here, in ischemic hepatitis or shock liver, what happens there is global hyperperfusion or hypoxemia. In addition to cardiac insult, other common causes is hypovolemic and septic shock as well as respiratory failure. Hepatocyte necrosis are found deep predominantly. If you do histology, hepatocyte uh, necrosis found in the zone 3 of the liver lobule. Zone 3 of the liver lobule. And that's the shock liver. This is uh, a tough term, but understanding the pathophysiology as well as understanding the mechanism will help you to diagnose shock liver.